So this is an autoclave machine. This is a chemical agent called Cydex, which we can use it for quick sterilization. Another machine which is ETO, which uses ethylene oxide for sterilization, which is a low temperature sterilization modality. This is the plasma machine, which is again a low temperature modality for sterilization. And this is the setup which we use for peel packing the instruments for either autoclaving, ETO or plasma. For sterilization of endoscope and endoscopy instruments, basically 4 modalities are available to us. One is an autoclave, which uses high temperature and pressure steam for sterilization. Like, share and subscribe for more medical insights. If you have any questions or topics you want us to cover, comment below. We'll be happy to create a video for you. This is Dr. Varun Agarwal, specialist in advanced robotics and endoscopic spine surgery. This is the commonest form of sterilization which is available in any hospital. The main advantage is that it is the commonest form of sterilization which is available in any hospital, and also it is the cheapest form of sterilization because it is being routinely used in the hospital. The disadvantage is that it uses high pressure and temperature, which may spoil some of the sensitive instruments. Sometimes endoscope also can get spoiled using in an autoclave, especially if it is not an autoclave compatible endoscope, or the instruments or devices which have plastic or meltable things which can get spoiled in an autoclave because the temperature goes up to 120 degrees. For sensitive equipments, one of the commonest modalities which we can use is an ETO, and less commonly, which is now becoming popular, is a plasma. So these two devices are low temperature devices which uses gas for sterilization. ETO is a little cheaper the machine is a little cheaper and modality is a little cheaper than plasma, which is the latest and most expensive. ETO, the main disadvantage with ETO is that it takes up to 8 to 10 hours for the ETO cycle to get complete, so we cannot get the instruments quickly. Plasma, on the other hand, is low temperature like the ETO machine, and the cycle is short like an autoclave, from around 30 minutes to 1 hour depending upon the setting, and we can use the instruments. The instruments get quickly available for the next surgery. The last modality for sterilization is chemical sterilization using Cydex. The instruments can be immersed in Cydex for 10 to 15 minutes before use. Personally, I don't like to use Cydex because I am sometimes not sure how much sterilization has been achieved, although there are sterilization markers available which can be put into Cydex simultaneously with the instruments, and they change color so that you know that the sterilization is proper. We use Cydex in our hospital only when we have cases back to back and we need faster turnover. For routine cases for longer duration and when we have to do the case next day, we use other modalities like sterilization using an autoclave or a ETO or a plasma. If you are using Cydex for sterilization, make sure it is constituted as per the instructions on the bottle, and a fresh batch is supposed to be made and used within 24 hours, and it should not be kept for more than 24 hours, and if possible you can use a fresh batch between each surgery also. So in our hospital we try to avoid using the chemical sterilization method as much as possible. We only use it when very quick turnover is required in case of emergency. For example, when an instrument has fallen down and we need it within 10 to 15 minutes, but usually our workhorse is an autoclave, and for sensitive instruments we use ETO or plasma.